Hi everybody, welcome to Dr. Manny's YouTube Learn Shops, and this is a continuation of the health assessment in an adult, and we'll be focusing on the cardiovascular and the peripheral vascular systems. So when we look at 4 clinical manifestations of the heart or the neck in relation to the vascular system, anomalies could include the blood pressure when last recorded, ECG findings, chest pain or discomfort, palpitations, and neck vein congestion. So, 4 clinical manifestations or anomalies of the cardiovascular system could be chest pain, peripheral edema, unexplained weight gain, shortness of breath, dyspnea, an irregular pulse or heart rhythm, dizziness, and poor peripheral perfusion. When it comes to manifestations that involve the peripheral vascular system, we might be looking at their legs and the feet for edema, swelling, legs and feet for pain, cramping, sores, ulcers on the legs, and the legs have a different colour, the feet have a different colour, which could relate to purplishness, redness or pallor, and certainly textural changes of the skin. So when we look at the physical assessment, when we look at the cardiovascular system, it's important to understand what it does. And as we always say, or I certainly do, what you see, what you hear, relates to what you know. If you don't know what normal is, you're not going to be able to identify what abnormal is. And again, understanding the cardiovascular system, as with any system, provides quality and safe care to the patient. So, when it comes to the physical assessment or examination of the cardiovascular system, this will involve vital signs, inspection, palpation, and auscultation, and certainly auscultation of heart sounds. So when it comes to the cardiovascular system, there's subjective assessment and objective assessment. With subjective assessment, this is important because it adds to your assessment. And again, we will be focusing also on family history, past medical history, medications, and lifestyle behaviours which could put the patient at risk. Symptoms are reported in the subjective assessment. These could include chest pain, edema effects, unexplained sudden weight gain, shortness of breath, dyspnea, irregular pulse and rhythm, palpitations, dizziness, and poor peripheral circulation. Common signs and symptoms of the cardiovascular system being disordered could include chest pain, shortness of breath, orthopnea, cough, diaphoresis, fatigue, nausea, edema, nocturia, palpitations, and a poor peripheral circulation. Subjective example questions could include things like, have you had any pain or pressure in your chest, neck or arm? If so, describe. Do you ever feel short of breath with activity? Do you ever feel short of breath while sleeping? Do you ever have shortness of breath while lying flat? Dizziness. Do you ever feel lightheaded? Do you ever feel dizzy? Have you ever fainted? Explain. Poor peripheral circulation could relate to, do your hands and feet ever feel cold or look pale or bluish? Elaborate. Do you ever have pain in your feet or lower legs when exercising? Cramping. which could indicate intermittent claudication. Subjective example questions could also include orthopnea. Have you ever had difficulty sleeping? How many pillows do you use? Do you awaken short of breath? Have you noticed any excessive sweating? Explain. Have you been especially fatigued or tired? Elaborate. Have you noticed any swelling in your feet, legs or hands? Do you need to get up in the night to use the bathroom? Do you notice that your heart is beating faster? Can you feel your heart beating? Are you having any skipped or extra beats? Also, these questions could relate to numbness and tingling. Do you have any changes in sensation in your hands or arms, your legs or feet? What makes it worse or better? And again, this is where you could be using your PQRSTU acronym, your old CARTS acronym, any acronym that gives you information. What about cramping? Do you ever have a cramping sensation in your legs? Is it sudden or gradual? Does it occur during exercise or activities? Can you walk without cramping? What makes the cramps better? In respect to their skin, you could be asking questions like, have you had any changes in your skin, hair or nails, integumentary system? What about your activities of daily living? Do you have any difficulties with your arms or legs affected with your functional abilities? Or are you able to continue with normal activities of daily living? Family history is again important. Do you have any family history of cardiovascular problems? If so, who had the problem and what was the problem? Vascular diseases could include coronary artery disease, peripheral arterial disease, cerebrovascular disease, renal artery disease, conditions related to your aorta, such as maybe an aneurysm, thoracic or abdominal. Heart diseases could include cardiomyopathies, hypertension, heart failure, pulmonary vascular disease, cardiac dysrhythmias, inflammation such as now endocarditis and myocarditis, inflammatory disorders, vascular heart disease, congenital heart disease, rheumatic heart disease. Questions related to past history could be, have you ever been diagnosed with a cardiac or circulatory condition such as high blood pressure, coronary artery disease, peripheral vascular disease, high cholesterol levels, heart failure, or heart valve problems? Have you ever had any procedures performed to improve your heart function? And these could include things like ablation therapy, stent placement, angiography. Have you ever had a heart attack or a stroke? Questions could relate to medications. Do you take any heart-related cardiovascular medications for things like blood pressure, chest pain, high cholesterol levels, abnormal heart rhythms, fluid retention, or blood clots? And if so, have you taken any supplements or over-the-counter medications to control your blood pressure, chest pain, cholesterol levels, cardiac rhythm, fluid retention, and clots? It's important with the cardiovascular system to be aware of lifestyle behaviours which put you at risk. So questions could include things such as, do you smoke cigarettes or do you vape? Do you smoke cigars? Do you smoke marijuana? If yes, how many do you smoke? If yes, how many years have you smoked? If you don't currently smoke, have you ever smoked in the past? And if yes, what did you smoke? Are you physically active during the day, the week? How many times per week do you exercise? And if you do, for how many minutes? What does a typical day look like in respect to your diet? Do you eat fruits or vegetables? If so, how many? Do you monitor the amount of fatty foods that you eat? Do you pay attention to the amount of salt in your diet? What about drinking coffee? How much caffeine do you think that you would have during the day? Do you drink alcohol? And if so, what type? How often? How many alcoholic drinks would you average in a usual day? What about stress in your life? How would you rate the amount of stress in your life from 0 to 10? How do you cope with stress in your life? And how much sleep do you normally get? Now, the equipment that we would use when assessing the cardiovascular system would typically be a pulse oximeter, a stethoscope, a watch, a pen light, if required, to look at the neck veins. Now, when we do the objective physical assessment, the important thing is to remember your vital signs. And the vital signs are typically temperature, pulse, respirations, blood pressure, pulse oximetry with the SpO2, and the assessment of pain. And I would like to include the level of consciousness. And it's important to interpret the blood pressure and the pulse readings to verify whether the patient is stable before proceeding with the physical examination, remembering that vital signs are taken not routinely, but to detect life-threatening conditions. So, assessing the level of consciousness, it's important the patient should be alert, orientated and cooperative, otherwise the information that you might get may be inaccurate if it's verbally supplied. The techniques are inspection, palpation and auscultation of the heart sounds. When you inspect the jugular vein, it's not visible, as I said, typically. When you inspect the upper extremities, inspect the fingers, hands, arms bilaterally, and you note the colour, the warmth, movement and sensation. You also assess the capillary refill time, which is less than 3 seconds. When you inspect the lower extremities, you inspect the toes, feet, legs bilaterally, noting colour, warmth, movement and sensation. The capillary refill time and the presence of any edema or superficially distended veins and hair distribution, which again may indicate perfusion issues, varicose veins, possible venous or arterial insufficiency. When we palpate, when doing a cardiovascular assessment, we palpate the carotid arteries one at a time. We determine the strength of the pulse according to the grade from 0 to 4. Typically, the pulse grade will be 2. We look at the precordium and we palpate it for lesions, masses or tender areas, and we use the palmar surface of our hand and our finger pads. And we place this over, as indicated, in the diagram in the left midclavicular line in the 5th or 4th intercostal space. You can begin at the apex of the heart, which is located in the left midclavicular line in the 5th intercostal space. Abnormal sensations that may be felt can be thrills, which are vibrations. Okay, you may actually feel a lift or a heave, which indicates incompetent valves, pulmonary hypertension, and possibly congenital anomalies such as septal defects of the heart. When we palpate the upper and lower extremities, we do this simultaneously. We assess the radial brachial pulses. We can also assess the femoral, popliteal, dorsalis pedis, and the posterior tibial pulses. When we assess, we use the 6 Ps: pain, poikilothermia, paresthesia, pulselessness, pallor, or paralysis. We also assess tincture, where we pinch the skin and we look for tenting. Normally, the skin texture is firm, even, elastic, and there is no skin tenting. The capillary refill time, as we've already mentioned previously, is less than 3 seconds. When we come to auscultation, we auscultate the carotid arteries, applying the bell lightly over the artery. And the artery is typically located medially to the sternocleidomastoid muscle in the middle of the neck and near the clavicle. We don't compress the artery. Normally there are no sounds or bruits heard. A bruit is an abnormal sound heard over an artery when there is obstruction. When we look at the heart, we auscultate routinely over 5 specific areas. And we listen for valvular sounds. These auscultation sites are aortic, pulmonic, herbs, tricuspid and mitral valve areas. And we use the diaphragm of the stethoscope to identify S1 and S2, which is a lub-dub sound. And typically the heart rate is between 60 and 100 beats per minute in an adult, and it's regular. When auscultating in the cardiovascular system, apart from the normal heart sounds, S1 and S2, you have extra heart sounds. And these can include clicks, murmurs, S3 and S4, which are sounds typically heard in heart failure. You've also got pleural friction rubs, and these are extra sounds that are very difficult, in most cases, for a novice to identify. Now, there are other sounds such as murmurs, and a murmur is just a blowing or a swooshing sound that signifies turbulent blood flow, which is often caused by a cardiac valve defect. And as I said, if you have an S3 or an S4 heart sound, it occurs after the S2 and sounds like not lub-dub, which is S1 and S2, but lub-da-bar, lub-da-bar. And this is often referred to by the academics as a ventricular gallop, because it sounds like a horse galloping, lub-da-bar, 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 lub-da-bar. In S4, this is referred to as an atrial gallop, because this occurs immediately before S1, and again is another sign of heart failure. And typically it sounds like this: talab-dub, 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 talab-dub. When you put them all together, S1, S2, S3 and S4, it sounds like talab-da-bar, 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 talab-da-bar. Is it important for you to identify these No. What's important for you to identify is the normal heart sound. As I said, if you don't know what normal is, you won't be able to identify what abnormal is. So focus on lub-dub, lub-dub, lub-dub. Listen to your own heart sounds, and God willing, they'll be normal. Lub-dub, lub-dub, lub-dub. An additional sound that comes from the cardiovascular assessment is called a pericardial friction rub. And essentially, this is now a leathery, sandpapery sound that's caused by inflammation of the pericardium. And this can be best heard at the apex of the heart, which is in the midclavicular line, as mentioned previously, on the left sternal border, in the fifth intercostal space. And it's best heard with the diaphragm of your stethoscope. Now, some of the disorders that occur with the cardiovascular system are peripheral arterial disease, and you can also include peripheral venous disease, which can be as a consequence of deep vein thrombosis. You can have an acute arterial occlusion of your limb, which will result in ischemia and infarction. Other conditions include thrombophlebitis, deep vein thrombosis, lymphedema. You can look at the diagrams to get an idea of what I'm talking about. Other disorders related to the cardiovascular system are chronic venous insufficiency, maybe neuropathy, which could be related to things like diabetes mellitus, where you get peripheral neuropathies because of decreased perfusion and damage to the nerves. Other potentially life-threatening issues are abdominal aortic aneurysm, can even be thoracic aortic aneurysm. There's a phenomenon called Raynaud's phenomenon disease, which results in pallor, ischemia, and potentially infarction of your fingers and toes. Okay, that's the end of that session. Thanks for attending. If you feel these Dr. Manny Learn Shops are of any value to you, please recommend them to your friends and your colleagues, and press the subscribe button or subscribe so that you're notified of any future lectures or presentations. Take care and God bless.